News with no bias.
News with no exception.
Delivering nothing but the truth. I am Esparrago.
And I am Zaki Ortega, inviting you to join this awareness episode of ZMTV because
your news is our business.
China has identified the cause of the mysterious new virus.
Coronavirus.
There are fears a rapidly spreading virus has reached Australia.
This is a rapidly emerging situation.
It's been 2 years since the World Health Organization declared COVID-19 a global pandemic quickly. The world came to a halt as leaders raced to control the spread of the virus. As of April 2022, there have been over 500 million confirmed cases of COVID-19, including deaths all around the globe. The World Health Organization said about our continued fight against the virus that the virus continues and we continue to face major obstacles in distributing vaccines and treatments. To know more information, Nojara and Espiel will tell us some facts about the coronavirus disease.
That is right. Having awareness on this kind of issue is really important to stay safe and healthy, not only to yourself but also to the people around you.
To give you an overview on what information will we offer, here is the catalog for this episode. First, definition and origin of COVID-19. Second, variants of the virus. Third, the disease's transmissibility and symptoms. Fourth, preventive measures and treatment. And lastly, global impact of the disease.
The coronavirus disease is an infection disease caused by a new strain of coronavirus known as the Severe Acute Respiratory Syndrome Coronavirus 2, a novel Severe Acute Respiratory Syndrome coronavirus. This new type of coronavirus and disease were unknown before the outbreak began in Wuhan, China on the 31st of December 2019. Coronaviruses are named for their appearance, corona, which means crown. The virus outer layers are covered with spike proteins and surround them like a crown. While the source of this disease occurrence is still highly debated, many health experts believe that the new strain of coronavirus likely originated in bats or pangolins in a Chinese wheat market. It has since spread around the world and declared as a global pandemic with large infection burdens in most parts of the world. Globally, there have been 500,186,525 confirmed cases of COVID-19, including deaths as of April 2022. In the Philippines, overall data accumulated by the World Health Organization from January 2020 to April 2022, there have been 3,682,083 of confirmed cases and the number of 59,891 deaths.
All viruses change over time, and this includes SARS-CoV-2, the virus that causes COVID-19. There are some changes that may affect the virus's properties, such as how easily it spreads, the severity of its respective disease, or the performance of vaccines on these viruses. The virus has already evolved multiple times. However, the variants that are alarming and needs tight monitoring are labeled to as variants of concern. According to WHO, findings have shown that the circulating variants of concern are Alpha, Beta, Gamma, Delta, and Omicron variants, where, as of April 2022, the dominant strains of the virus are Delta, that caused more than twice as many infections as previous variants. It was estimated to have been 80 to 90% more transmissible than the Alpha variant. It also had a double hospitalization risk with a more severe disease than other variants, especially in people who weren't vaccinated. Omicron and its BA lineages. Researchers found out Omicron is about 2.7 to 3.7 times more infectious than Delta in vaccinated and boosted people. However, it appears to cause less severe diseases. According to the study authors, if confirmed, these findings support the idea that Omicron's increased transmissibility will be due to the variant's ability to evade immunity.
With the government's intervention through implementing different types of community quarantine, namely enhanced community quarantine, modified enhanced community quarantine, general community quarantine, and modified general community quarantine imposed by the National Task Force, depending on the COVID-19 alert system determined by the Interagency Task Force to specify the public health and social measures to be taken in relation to the COVID-19 response to that specific location, having limited number of people to go in and out from their homes. Furthermore, given the President's approval of the recommendation for the progressive expansion of face-to-face classes for both public and private schools for CHED and DepEd, All of this during a global pandemic, how can this virus be transmitted and prevented, particularly at home and school?
Whether or not they have symptoms, infected people can be contagious and the virus can spread from them to other people. Laboratory data suggests that infected people appear to be most infectious just before they develop symptoms, namely 2 to 14 days before they develop symptoms. Where can one be exposed to the virus? The 3 C's are a useful way to think about this. They describe settings where transmission of the COVID-19 virus spreads more easily. This is close contact settings, especially where people have conversation very near to each other. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. Another person can then contract the virus when infectious particles that pass through the air are inhaled at a short range. This is often called short-range aerosol or short-range airborne transmission, or if infectious particles come into direct contact with the eyes, nose, or mouth, droplet transmission. Confined and enclosed spaces with poor ventilation. This is because aerosols can remain suspended in the air or travel farther than conversational distance. This is often called long-range aerosol or long-range airborne transmission. The risk of COVID-19 spreading is especially high in cases where the three C's overlap.
High-risk group for COVID-19 includes people who are older than 60 years or who have health conditions like lung or heart disease, diabetes, or conditions that affect their immune system. The virus can be transmitted to anyone regardless of age. However, the bodily reaction varies from mild to severe from those who have weaker immune system to those who are older in age. When exposed to the virus, COVID-19 can cause a variety of symptoms, the two most prevalent of which are similar to flu symptoms, such as fever and the dry cough. Is fatigue, aches and pains, and nasal congestion. Researchers have identified a set of 7 symptoms that, when taken together, could be used to increase COVID-19 detection in the community. And as the pandemic spread around the world, new symptoms emerged, such as loss of smell or taste, loss or change of smell, loss or change of taste, fever, new persistent cough, chills, appetite loss, and muscle aches are all symptoms that are predictive of a positive PCR test. One can also experience mild to moderate respiratory illness. However, some will become seriously ill and require medical attention. Older people and those with underlying medical conditions like cardiovascular disease, diabetes, chronic respiratory disease, or cancer are more likely to develop serious illness. In the Philippines, with a 1.6% case fatality rate, anyone can get sick with COVID-19 and become seriously ill or, in the worst case, die at any age.
To prevent the spread of COVID-19 at home, keep COVID-19 outside your home. The best way to prevent the spread of COVID-19 in your home is to keep the virus from ever entering it. Here are some ways to keep you safe and healthy. First, get vaccinated. Getting the COVID-19 vaccine is the best way to protect yourself and your family from infection. Currently, the government is in the initial phase of vaccine rollout with the availability of Sinovac, AstraZeneca, Pfizer, Sputnik V, and Janssen vaccines in the country. Second, protect yourself from COVID-19. Here's what you can do to keep your family safe when you return from trips out in public. Wash your hands with soap and water for at least 20 seconds before you touch anything or anyone in your home. If soap and water aren't handy, use an alcohol or based hand sanitizer with at least 60% alcohol. Disinfect surfaces that you and others often touch in your home, including doorknobs, light switches, countertops, phones, and keyboards. If surfaces are dirty, clean them with detergent or soap and water before disinfecting, since people may also become infected when touching their eyes, nose, or mouth after touching surfaces where numerous people have commonly come in contact with, such as doorknobs and handles. Since the virus can survive for up to 3 days on surfaces, particularly plastic or metal.
To prevent the spread of COVID-19 in schools should promote vaccination. COVID-19 vaccination among all eligible students as well as teachers, staff, and the respective household members is the most critical strategy to help schools safely resume full operations. Students, teachers, and staffs should use masks consistently and correctly. Consistent and correct use of masks is important, especially in indoors and in crowded settings when physical distancing cannot be maintained. Students, teachers, and staffs should observe physical distancing. During in-person learning, schools should implement physical distancing to the extent possible within their structures, but should not exclude students from in-person learning to give a minimum distance requirement. In general, CDC recommends people who are not fully vaccinated maintain a physical distance of at least 6 feet from other people who are not in their household. Schools should have a screening testing. Screening testing identifies infected people, including those with or without symptoms, who may be contagious, so that measures can be taken to prevent further transmission. These can help promptly identify and isolate cases, initiate quarantine, and identify clusters to help reduce the risk to in-person education. Schools should improve ventilation. By opening multiple doors and windows using child-safe fans to increase the effectiveness of open windows and making changes to the HVAC or air filtration systems can improve ventilation that reduces the number of virus particles in the air and keeps it from concentrating inside.
Practice the hand washing and respiratory etiquette. Practicing hand washing and respiratory etiquette, such as covering coughs and sneezes, prevents exposure and spreading of viruses. Schools can monitor and reinforce these behaviors and provide adequate hand washing supplies. Next we have stay home when sick and getting tested. Students, teachers, and staff who show symptoms of the virus should stay home and be referred to their healthcare provider for testing and care, regardless of vaccination status. Contact tracing in combination with quarantine. Schools should continue to collaborate with the state and local health departments to the extent allowable by privacy laws and other applicable laws to confidentially provide information about people diagnosed with or exposed to COVID-19. This allows for identifying which students, teachers, and staff with positive COVID-19 test results should isolate and which close contacts should quarantine. Lastly is to clean and disinfect. Besides personal hygiene, maintaining the cleanliness of our environment allows us to remove potential viruses that may be on surfaces, which further reduces any risk of spreading infection. When someone is exposed or infected with COVID-19, quarantine will follow. Staying completely away from other people inside the home, because someone can be infected without feeling symptoms. This helps limit the spread. If someone in your household may have been exposed to COVID-19 or is diagnosed with infection, first is to establish a room and a bathroom if possible. That will only be used by the person under quarantine. Don't share plates, glasses, cups, or utensils. Don't allow visitors in your home. Monitor the health of all household members. Each person should call their healthcare provider if they develop symptoms of COVID-19. Anyone who becomes sick should stay home, completely isolate themselves from healthy people, and follow their healthcare provider's guidance.
Now you know. I am Jake Marcellana, and this is Reminder. To assess understanding for this episode, I will provide a 5-item quiz with 10 seconds each to answer the question. Are you ready? Here we go. Number 1. What preventive measures should you take in order to protect yourself from the virus? A. Use masks consistently and correctly. B. Observe physical distancing. C. Constantly sanitize or wash hand. Or D. All of the above. The correct answer is letter D. All of the above. Number 2. What is the incubation period of COVID-19? The correct answer is 2 to 14 days. When someone is exposed to the virus, symptoms may appear between 2 to 14 days. Number 3. Which organ in the body does this coronavirus primarily attack? A. Heart. B. Lungs. C. Liver. The correct answer is letter B. Lungs. Number 4. How long can the virus survive on plastic and stainless steel surface according to studies? A. 72 hours or more. B. 24 hours or more. C. 12 to 24 hours. Recent study evaluated the survival of COVID-19 virus on different surfaces and reported that the virus can remain viable for up to 72 hours on plastic and stainless steel, up to 4 hours on a copper, and up to 24 hours on a cardboard. And now, the last question. Can you use paracetamol as treatment of the symptoms of coronavirus? Yes or no? The National Health Service or the NHS UK has advised on that patient can take either paracetamol or ibuprofen to self-medicate for the symptoms of COVID-19 such as fever or headache.
The COVID-19 pandemic has led to a dramatic loss of human life worldwide and presents an unprecedented challenge to public health, food systems, and the world of work. The economic and social disruption caused by the pandemic is devastating. Tens of millions of people are at risk of falling into extreme poverty, while the number of undernourished people, currently estimated at nearly 690 million, could increase by up to 132 million by the end of the year. Furthermore, millions of enterprises facing an existential threat. Nearly half of the world's 3.3 billion global workforce are at risk of losing their livelihoods. Without the means to earn an income during lockdowns, many are unable to feed themselves and their families.
Now is the time for global solidarity and support. especially with the most vulnerable in our societies, particularly in the emerging and developing world. Only together can we overcome the intertwined health and social and economic impacts of the pandemic and prevent its escalation into a protracted humanitarian and food security catastrophe with the potential loss of already achieved development gains. We must rethink our ways and reevaluate our actions. Only then can we protect the health, livelihoods, food security, and nutrition of all people and ensure that our new normal is a better one.
I am Marcellana Esparrago.
And I am Zaki Ortega, concluding this awareness episode of ZMTV saying,
Your news is our business.